you guys. So let's get started. I'm gonna share my screen. Okay, I'm Juan Ramirez and I have a master's in public health from the University of Texas at El Paso, or UTEP. I currently work at Yakima Valley Farm Workers Clinic. What's that? That's a federally qualified community health center in the state of Washington and Oregon. So even though our name is in singular, we're not only one clinic, we are many, many clinics. So let me go back a little bit. And if you guys haven't heard of community health centers before, a community health center, it's pretty much a medical clinic, a primary care clinic or place to go and see your doctor, your provider. So we have many, many, many medical clinics throughout Washington and Oregon. My title is Public Health Manager, and my department is Health Education. Within my department, I oversee 3 programs. What's public health? Public health is making communities healthier and happier. It's finding the way to make that happen. And you can study public health at different levels. The first level would be a bachelor's. And I need to mention that not all of universities name bachelor's in public health exactly like that. For example, UTEP has the bachelor's in health promotion, which is exactly the same thing. I don't really know why they name it health promotion and not public health, but maybe that's because they have the master's in public health and they just wanted to differentiate between the bachelor's and the master's, but I don't know. So the point is that whenever you are looking for these bachelor's, even if it's not exactly public health, but it's related to public health or health promotion or has the word health in it, that means that it's most likely public health. Then there's masters in public health, and for the master's degree, all universities are going to name it exactly the same, and that would be masters in public health. If you want to go farther, then there's the DRPH and the PhD. The DRPH is a doctorate in public health, and the PhD, Doctor of Philosophy in Public Health. It's basically the same level, but one of them requires more research. The PhD level requires more research than the DRPH. The DRPH is more practical, is for people that are already working in the public health industry within an organization and they want to elevate their skills and their knowledge. Or in my case, that's something that I'm looking into and that eventually I'm going to pursue the DRPH, not the PhD. PhD would be more for those that want to work in a university and want to become a professor or dedicate their life to research. Okay. There's 10 essential functions of public health. This means that if you study public health, you can find yourself doing one or more than one of these essential functions, which honestly, just doing one of them, it's very rare. you you find yourself doing more than one as soon as you start working in public health. One of them is monitor health, another diagnose and investigate, inform, educate, and empower, mobilize community partnerships, develop policies, enforce laws, link, link to and provide care, assure a competent workforce, evaluate, and research. And just for you guys to know, research is something that we are constantly doing within public health. That's because we need to keep up with the latest articles, or it all depends on what area we're working in, but most of us are constantly keeping up with new articles and new research. I want to share with you my position competencies or my job description. Here you're gonna see the title of my position, which is Public Health Manager, the title of my supervisor, who is the Chief Program Operating Officer. My position is exempt and I supervise other positions. And it says various by position because I have multiple different positions under me. When you study public health, you don't necessarily have to supervise others. That's depending on what you want to focus on. And since I'm more in the administration area, then it's most likely that anyone in this area would supervise staff. Okay, but if you want to just do epidemiology, for example, then it can be just you and you're working with a computer and not having to supervise anyone else. But there's also opportunities to supervise and not supervise, depending on your preference. The purpose of my position, as you can see here on the slide, is to oversee, implement, and expand the Tomando Control de su Salud, Read, Chat, and Read, and Los Niños programs. Partners with internal and external stakeholders to promote program utilization and benefits, coordinates training program execution across Washington and Oregon state, and monitors program success and utilization. Scope includes oversight of multiple positions, development and oversight of program budgets, and program delivery accountability to meet desired outcomes. This means that I work pretty much with programs. So I work directly with programs. And that's what I love. And there's hundreds or even thousands of different programs and different areas. For example, I have 3 different programs and each of them is in a different area. So you're gonna learn more about that in a little bit, but that's something that I love and that public health can give you if you are looking at implementing programs or supervising staff or improving programs or anything related with a program, and specifically a public health program. Okay, so the qualifications, as you can see here, you can qualify if you have a bachelor's degree in public health or related field. If you have 4 years of experience, that may substitute the education requirement, or if you have a master's degree, that may substitute for the experience requirement. All right, let's go to the next slide. So here are my programs, the 3 programs I was talking about. The first one, and the one that takes most of my time, is the Chronic Disease Self-Management Program. Before COVID, these programs, all of the programs that I'm going to talk to you about were in person. So the classes were in person, but now we're doing them via Zoom. And one of the fun part of public health is that you need to be adapting constantly to the situation that you are in, or the new normal. And our new normal was to provide education virtually. right? Because one of our responsibilities as public health professionals, and especially in my programs, is to educate and to help others improve their health outcomes. So imagine with COVID, we saw ourselves limited in doing those in-person classes and in helping others. So we were like, okay, so what's the solution? The solution is transition our programs to a virtual modality. And that's what we did. And now all of our programs are, or the class-based programs are offered via Zoom. This program, we have it in English and Spanish, and it's an evidence-based program that was created by Stanford University. It's a 6-week workshop. Meetings or sessions are once a week for 2.5 hours. Throughout the workshop, participants learn how to communicate better with their family, friends, medical team. They learn about nutrition, they learn about exercise, they learn about decision making, about action plans, about the power of the mind, and many, many other important topics. They basically get tools to manage their health condition. And this program is for people with any kind of chronic condition, such as diabetes, arthritis, obesity, hypertension, asthma, etc. Let me show you real quick um, the books that we use for that program. So this is the book in English, Living a Healthy Life with Chronic Conditions. They get this book for free. This is the Spanish version of the book, Tomando Control de su Salud. That's actually the name of the workshop in Spanish as well, Tomando Control de su Salud. And they also get 2 CDs, one with exercises and another one with relaxation techniques or meditations. So that's a chronic disease self-management program. Then we have the parenting education program. And the book for that program is this one. This program, it's only in Spanish and it's called Los Niños Bien Educados. Okay, so parents, even though the name is Los Niños Bien Educados or well-behaved children, you could think that the program is for children, but no, it's for the parents, because the parents are the ones that need to learn the techniques and tools to better communicate, to better educate, and to better raise their children. And that's why the program is for the parents, not for the children. Okay, and this is also a 6-week long workshop, and it's free for our families. When I say for our families, it's for the families that we serve. And then the third program that we have is the Read, Chat, and Read program. And that's basically when children from 6 months to 5 years of age go to the clinic to see their provider for their well child check. That provider gives them a book. They give this kind of books to the children or to their parents. And for example, this is in Arabic. So it's bilingual, English and Arabic. And that's because we do have clinics like Portland and Spokane, where are very diverse, and we have populations that speak different languages other than English and Spanish. For example, this one is in Chinese and English. Okay, so that's also the beauty about public health, that you can help people of all ethnicities, of all colors, that speak any kind of language, and it's amazing. Health, it's a universal language, and public health is so. Let me share my screen again. Okay. Go to the next one. I want to show you guys a report. This is one of of the scorecards that I submit to my supervisor on a monthly basis. And this one is for last fiscal year. So our fiscal year starts in April and ends in March. Here, if you can see on the left, the top left, it says fiscal year 2020. So that means that these numbers here are from April 2019 to March 2020. Okay, what you can see here under program activities are my 3 programs. In blue, you're gonna see here Tomando Control de su Salud and CDSMP. So Tomando Control, it's the Spanish version, and then CDSMP is the English version. Okay, and then to the right, you're gonna see current month. That's the number of patients that attended that month. So that month we had 78 patients attending. And then next to it, it says YTD, FY 2020. That's year to date, fiscal year 2020. So that's the number of participants that have attended throughout the year, throughout the whole year. And that's 771. Next to it, it says FY 2020 goal. That was our productivity goal. So that 720 was our goal. So we exceeded our goal, which is great. And then to the right, you're gonna see FY 2019, which is fiscal year 2019. So the previous year, we had 637 participants. That means that fiscal year 2020, we served more participants or more patients than fiscal year 2020. We served over 100 more patients. And that's across the organization. It's including Oregon and Washington, which is great. One of our goals is obviously to serve as many patients as possible, obviously within our budget. We always have a budget when we work with programs, and that's something that you will be learning about. And that's when you need to be playing with numbers and using numbers, because you need to manage budgets. And that's mainly if you supervise staff, and if you supervise programs. But if you are in a different area, like just doing research, it's most likely that won't be needing to work with budgets. But it's really interesting working with budgets. So that's one. And then we have Los Niños Bien Educados, and same, we have the goals for the year, for the previous year. And then we have Read, Chat, and Read, and that's the number of books distributed in that fiscal year. So in that fiscal year, we distributed 5,988 books. And that's because in March 2020, that's when, on March 2020, that's when COVID happened. And that month, we had to stop distributing books, just because we were learning how to really keep those hygienic practices, right? And those infection control practices. And we decided to stop distributing books until we were able to ensure that we had strategies to avoid any kind of contamination or infection. So this is one report, and this is just one of many reports that are out there. And here you only see numbers, but my point here is that to make this happen, to make people come to your program and actually complete your program and benefit from your program, it's a lot of work behind scenes that take place. And that's when you come in, to play, and when you need to be creative and use all your skills. Some of those skills you learn at school, some others you don't, and you're going to be learning working. And that's just to be honest with you guys, but school won't give you all the experience and all the knowledge That's why internships and any practicums or any volunteering opportunities that you can find while you are studying, where you are a student, I highly encourage you to take advantage of all of them, because that's how you're gonna start getting experience. Okay, it's two totally different worlds: school and the actual workforce, or the workplace. So just keep that in mind, and as soon as you start getting experience, you see how exciting everything is. Okay, so this is just my information in case you guys have additional questions or you want to ask me for something specific. I know we don't have a lot of time right now to talk more about public health. As I mentioned, public health is super broad. It's a lot. My main focus is programs. So that's what my expertise are on and what I'm passionate about. And if you guys have any questions at any point, feel free to reach out to me. That's everything I have, and well, was nice presenting to all of you, and wish you the best. Hope you make the right decision, and remember, keep doing your research until you feel that you are making an informed decision. Don't just start studying something because you need to study something, but because that's what you are passionate about. Okay? See you guys.